still drinking milk after 60, stop. Mixing it with these 7 foods. It could be silently draining your bones, doctors warn. These 7 common foods plus milk equals bone loss after 60. Are you unknowingly doing this? Milk is great for bones, right? Not when you combine it with these 7 foods after 60. Here's why it backfires. Bone health after age 60. Bone health in older adults is critical because bone density naturally decreases with age, increasing the risk of osteoporosis and fractures. Calcium, vitamin D, protein, magnesium, and vitamin K are essential for bone maintenance. And milk is a rich source of calcium, about 300 milligrams per cup, and often fortified with vitamin D. However, certain foods or compounds may interfere with calcium absorption or bone metabolism, which could contribute to the weakens bones narrative. Common foods often cited as problematic with milk based on web sources and dietary discussions around bone health. Here are 7 foods or categories frequently mentioned in warnings about mixing with milk, along with an analysis of their effect. Oxalate, food spinach, rhubarb, beet greens. Oxalates in foods like spinach bind to calcium in milk, forming insoluble calcium oxalates that reduces calcium absorption. Oxalates can indeed bind calcium in the gut, potentially reducing its bioavailability. For example, spinach contains high levels of oxalates, about 750 milligrams per 100 grams, which can inhibit calcium absorption from milk if consumed together. However, this effect is minimal unless consumed in large quantities simultaneously. A varied diet with adequate calcium intake, 1,000 to 1,200 milligrams per day, mitigates this risk. Cooking spinach reduces oxalate content by 30 to 50%, lessening the impact for those over 60. The effect is negligible unless the diet is heavily reliant on high oxalate foods and low in calcium. Eating these foods separately from milk can help, but there's no need to avoid them entirely. High phytate foods, for example. Wheat bran. Certain grains claim phytates. In wheat bran and grains bind calcium, reducing its absorption. Evidence: phytates, found in concentrated wheat bran, for example. 100% wheat bran cereal can reduce calcium absorption by forming insoluble complexes. A WebMD source suggests waiting at least 2 hours between consuming concentrated wheat bran and calcium-rich foods or supplements. However, phytates in moderate amounts, for example, in whole grain bread, have a minimal effect. The impact is minor for most diets. Fermentation, for example, in sourdough or soaking grains can reduce phytate levels, improving calcium absorption. Those over 60 should ensure adequate calcium intake from varied sources. Caffeine, for example, coffee, tea, cola claim. Caffeine increases calcium loss through urine, weakening bones when consumed with milk. Caffeine causes a slight increase in urinary calcium excretion, but the effect is small and only significant if calcium intake is low. The Royal Osteoporosis Society suggests limiting coffee to 4 cups daily and balancing it with calcium-rich foods, for example, milky coffee. Tea may have less impact due to flavonoids that could benefit bones. Cola drinks with phosphoric acid may pose a risk if consumed excessively in place of milk. But evidence is inconclusive. Impact on bones: moderate caffeine, 2 to 3 cups of coffee daily is unlikely to harm bones if calcium intake is adequate. 1,200 milligrams per day for women over 50, 1,000 milligrams for men. Avoid replacing milk with high caffeine beverages. High sodium foods: high sodium increases calcium excretion, reducing bone density. Excess sodium can increase calcium loss through urine, potentially weakening bones over time. Foods like processed meats, cheeses, and canned goods are high in sodium. Reducing sodium to 1 to 2 grams daily helps retain calcium. PCRM.org, WebMD.com. Impact on bones for older adults. High sodium diets are a concern, especially with low calcium intake. Limiting processed foods and seasoning with herbs instead of salt supports bone health. Alcohol claim. Excessive alcohol with milk harms bones by reducing calcium absorption. Evidence: heavy alcohol consumption, more than 1 to 2 drinks a day, impairs calcium and vitamin D absorption and inhibits bone formation. Moderate alcohol, 1 drink per day for women, 2 for men under 65, has minimal impact. Drinking alcohol with meals may slightly reduce calcium absorption, but the effect is small. Excessive alcohol is a risk factor for osteoporosis, particularly in older adults. Limit intake and avoid combining heavy drinking with milk-heavy meals. Sugary foods, reduce calcium absorption or weaken bones when mixed with milk. There's no direct evidence that sugar inhibits calcium absorption from milk. However, high-sugar diets, sugary cereals with milk, may displace nutrient-dense foods, leading to poorer bone health. Plant-based milks with added sugars, vanilla almond milk can also contribute to this issue if overconsumed. For those over 60. Excessive sugar may indirectly harm bones by contributing to obesity or inflammation. Choose unsweetened milk and pair it with low-sugar foods like whole grains or fruit. Acidic foods create an acidic environment that leaches calcium from bones when consumed with milk. The acid-alkaline diet theory, which suggests acidic foods harm bones, lacks strong scientific support. The body tightly regulates blood, pH, and dietary acidity has little impact on bone calcium. Citrus fruits, despite being acidic, are rich in vitamin C and potassium, which support bone health. Milk's protein content, which is slightly acid, actually benefits bones by improving density. Acidic foods are safe to consume with milk and may even enhance bone health due to their nutrient content. There's no need to avoid them. Bone health is multifactorial. Diet is only one factor. Weight-bearing exercise, vitamin D from sunlight or supplements, 600 to 800 IU per day, and avoiding smoking or excessive alcohol are equally critical. Genetics also play a 60 to 80% role in peak bone mass. Recommendations for bone health after age 62: maintain strong bones. Focus on a balanced diet and lifestyle rather than avoiding specific food combinations. Calcium-rich foods. Aim for 1,000 to 1,200 mg of calcium daily from milk, yogurt, cheese, fortified plant milks, leafy greens, tofu, or sardines. 3 servings of low-fat dairy. 1 cup milk equals 300 milligrams. Calcium meat most needs vitamin D. Ensure 600, 800 IU day through fortified milk, fatty fish, eggs, or supplements, especially in winter or low sunlight areas. Protein. Adequate protein 25 to 35% of daily calories from dairy, fish, beans, or lean meats supports bone tissue. Moderate caffeine and avoid excessive high oxalate or high phthalate foods with calcium sources. If intake is low, engage in weight-bearing walking, resistance training, and balance exercises to reduce fall risk and improve BMD supplements. If dietary calcium or vitamin D is insufficient, consider supplements: 1,200 milligrams calcium plus 600 to 800 IU vitamin D. But consult a doctor to avoid oversupplementation. Milk is harmful. Claims that milk itself weakens bones, for example, due to degalactose or acidity, are not supported by most RCTs. Meta-analyses show dairy improves BMD, though fracture prevention is less clear. Plant-based milks, fortified almond, soy, or oat milks are viable alternatives for lactose-intolerant individuals, providing similar calcium 350 to 400 milligrams per cup if unsweetened. Welcome to Natural Health and Wellness, where, here too, help you live stronger, feel younger, and stay healthier naturally. From expert-backed tips for heart health, joint care, and weight loss to powerful remedies, senior wellness, and everyday nutrition, this is your go-to hub for real lasting health. Subscribe now and turn your health journey into a lifestyle.